Good morning. We are officially the morning of surgery. It is 5:30 a.m. We're going to be leaving very soon because I have to be at the hospital for 6:45 in the morning. The hospital where Dr. Leblanc operates is the Centre Chirurgical de Laval. So anyways, I am going to keep filming as we head out. And Dr. Leblanc actually texted me last night, and he's gonna be as assisting as possible in trying to document and film this journey. So he'll probably explain some things on camera too. So anyways, I will check in with you guys soon. So we just got here. I'm actually a little early. I'm never early for anything, but things like this, we are. Hubby is more nervous than I am, I think. Say hi, Sergio. Okay, so I'm sitting here. They've taken my temperature, they've taken my blood pressure, signed a bunch of papers. This is so much more comfortable than the last surgery that I had, just because everything was done like on a floor of the hospital. You can see like I'm chilling in bed. I got a warm blanket on me. I'm really much more relaxed than I thought I would be. And apparently the anesthesiologist is going to come and see me, and Dr. Leblanc. So yeah, I'll keep you guys posted.
The news is we don't have COVID. Second good news, you're not pregnant. And the third good news is that we're having surgery today. So, first and foremost, we'll just summarize what we'll be doing today. So today we are doing a bilateral surgery. I guess we're doing both sides.
Mm-hmm. I hope so.
Unless you want to do one next week.
No, it's okay.
So, so we're talking about a bilateral breast implant exchange. 2. Unless you want 3.
No,
like one in the back.
No.
Or, okay, we'll go old school, boring, like 2 up front. So we did decide on using cosmetic implants. Do you remember what type of volume that we talked about?
You said you were going to do something similar. I asked to go a little bigger than what I have now, but you told me no.
Yeah. So when I operate, I use temporary sizers,
yeah.
like temporary implants. So
Yeah.
I actually see what's happening during surgery. So we did talk about like using very similar volume in your case. Things that we don't want to have is double bubble. Obviously, the larger the implant, the heavier the implant. Mm-hmm. It puts more stress on whatever repair we'll be doing, especially in the lateral portion of the.
Because it's wider.
Because it's not as solid tissue as, let's say, the infirmary fold, where we'll be performing the internal bra. So everything is very solid. It's like leather. So when we anchor our internal bra, very solid.
Okay.
Here, we're still, if you remember, we're still depending on the quality of the capsule and your soft tissue. So let's say we put a very, very large implant, let's say 800 cc implant. This technique is very solid, but with time, it will stretch out.
So then because I have that right now, right? That it like goes into my armpit. That's going to be corrected though?
It is. Okay. So that's part of the surgical plan. So we'll be doing a lateral capsulorrhaphy, but a combined version of a Swedish surgeon, Dr. Renquist. It's called a thermal capsulorrhaphy, or otherwise called popcorn type capsulorrhaphy, where we take an electrical current and we basically pass it through the capsule. Okay. And what it does, it actually shrinks that capsule. Okay. So, and you do have like very flimsy capsule, like very soft, which is what we want, because we don't want like breasts that are hard as a rock. Yeah. So what it does is actually closes that space, and the capsule becomes a little stiffer, a little stronger. So on top of that, we'll be using a barbed suture, and we'll be doing a number of rows of extra repairs. Okay. So that's why that repair is more solid than the usual techniques. Okay. But even though it's a lot more solid, if you put a very large implant, it's going to stretch that thing out. So that's why the volume that we did talk about is probably around the 550 mark. Okay. If I see that during surgery, we can put a little bit more, or if we want to correct the volume asymmetries, then we can play with that volume, which would make sense.
Yeah, and it was a high profile, right?
Exactly. So we did talk about using a high profile implant to give more support, give more volume up top, and just have like more like upper pole fullness effect. And also we will do the internal bra technique, which in your case, since you've had implants before, is a combined technique. So it's the Rehnquist technique, so the electrical current thing. So I actually do it in your capsule. So whatever capsule that bottomed out will stretch out, so it brings things up. And then on top of that, we use the barb suture again, and we do a few rows, and we reattach your inframemory fold, which means that we take all that area and we tack it down. Patients usually use their term tack, or like tack down, and we use whatever's solid. Fascia, periosteum, which is the envelope around the bones, and we go deep, and we do a number of these rows to make it as solid as possible, and to get rid of that
extra skin.
Exactly, in the inferior implant migration. And we did talk about using a type 3 firmness implant. Remember, if you got like 3 types of firmnesses, 1, 2, 3, you have a type 1, which is a soft implant. So we'll go for a firmer implant, give more support and more volume on top.
Perfect.
That makes sense?
Yeah.
Good.
Before we go any further, I thought I'd share with you guys some photos of what I look like about 2 months after my original surgery. My issues started very early and were actually very obvious. This video that you're seeing here was taken about 1.5 years after my first surgery. The issues that you saw in the previous photo actually only got progressively so much worse. I had everything from severe bottoming out and lateral displacement. In fact, it was so bad that when I would lie down, the implants would go so far deep into my back that it was painful, so I was always sleeping in a sports bra. I also had a lot of rippling on the sides, as well as exaggerated muscle animation deformity that you guys will see in a second, and stretched tissues at the base of the breast that you can really see better in these photos that Dr. Leblanc took in my original consult. Anyways, into the operating room we went. The surgery was anticipated to be about 3 hours, but actually took him over 4 hours to correct. In fact, he had told me that it's actually one of the most challenging revision cases that he had seen in his practice in years, but the results were phenomenal. So the first thing he did was remove my old implants, among some other things that I probably could not repeat. However, at this point, he's actually created my internal bra on one side and not the other. You guys can really see how much support it actually offers at the base of the implant to prevent the bottoming out from reoccurring. And there we have it, the result of a little over 4 hours of hard work in the operating room. In addition to the internal bra, he had also performed a lateral capsulorrhaphy and closed up my sides with a quadruple barbed wire suturing to reinforce it as much as possible to prevent any shifting laterally into my armpits and back. He had also swapped out the implants for a firmer, higher profile implant. The ones that I previously had before were a little mushier and didn't project as much from my chest, so this was going to help me yield the results that I wanted. I previously mentioned as well the excessive muscle animation deformity that I had. You can see with my old implants, when I would flex, the muscle would push the implants heavily downwards and out. To an extent, having this kind of animation is normal, but minimally speaking, what I had was exaggerated, and Dr. Leblanc had fixed that in my revision. You can see here I'm flexing with all of my might and they're not going anywhere.
Today is the night after surgery. I don't even know what time it is, probably like 9:30 or 10. But anyways, I really haven't been in pain all day. No nausea, no bloating or anything. People keep commenting on how good I look for someone who has just gotten out of surgery. And that is definitely something to have to do with how the anesthesiologist goes about the sedation rather than putting you under general anesthesia. So right now I still have a block, like I'm kind of numb. It's starting to wear off a little bit. I definitely feel a lot more pressure, feeling a bit more pain at my fold. And that'll probably wear off probably by morning. So I figured I would kind of go over a bit more in detail what transpired today, because I definitely feel like it's a hospital experience that is totally out of the normal realm in the plastic surgery world. And when I say out of the norm, I mean that really in the best of ways. I was actually brought directly to a private room with a bed. I was placed in that bed and the girl brought like the hottest warm blanket, which was, she like cocooned me up and it like felt so good. So I was super comfortable. The nurse came into the room and went over all the paperwork and everything with me while I was lying in bed, asked me all the questions. So I was super comfortable in that sense. As far as I know anyways, most of the time you'll do this kind of like at a desk. I think last time it was just done like in the hospital, you know, like signing papers, which is totally fine. That's the normal protocol. I'm just telling you how the protocol is definitely different with Dr. Leblanc. After that happened, Dr. Leblanc actually came directly into that room and did his markings on me. We also chit-chatted and went over so many different things, and he like pulled out his phone at one point and he starts playing like this relaxation music. Apparently he does it for all of his clients, and it's scientifically proven to kind of help relieve some anxiety. Honestly, he's so amazing, so compassionate, he's cracking jokes. Once he's done doing that, the anesthesiologist actually came to see me. Now typically when you go in for a plastic surgery, the surgeon will meet with you to do the markings and everything, but then usually you're escorted to the OR room where you're fully competent. Like you walk into the room, and at that point you'll be introduced to the anesthesiologist, the nursing staff and everything, and there's like a whole bunch of things that are going on, and it's kind of the normal situation, and like I said, there's nothing wrong with that, but I definitely feel like the way that Dr. Leblanc has adjusted his protocol definitely makes the experience that his patients have anyways to be much more comfortable. And the anesthesiologist came in with his nurse, and he was also hilarious, cracking jokes, whatever. Like, I have nothing but the best things to say. Explained to me what they were going to be doing, and they did two things. First thing, his nurse put in the intravenous thing in my arm, and to be honest with you, that was like the most pain that I felt today, because the anesthesiologist did an ultrasound of my back. So basically the block, the thoracic cage block that they're giving you, it's a needle that's going to go through the back. They don't actually give you the needle right then and there. He just does an ultrasound to see, I guess, where they're gonna mark your back, where they're gonna put it. And they actually start to give you some of the intravenous anesthesia, the sedation there. So you really do start to, like, I remember kind of fighting it. My eyes are kind of doing this, and you're starting to feel loopy, but they're not giving you enough to put you to sleep. So you're really just kind of like, you know when you get like tipsy, but not too tipsy, you're like a happy drunk? It's kind of like that sort of feeling. And from there, they actually roll the bed directly into the operating room. So you're not actually walking in there and like freaking out and panicking and being fully competent. So once I got into the OR room, Dr. Leblanc, the whole staff was there and everything, and they advise you when they're basically going to give you the rest of the anesthesia to put you to sleep. I'll actually insert a little bit of a footage because Dr. Leblanc had sent me a video of me apparently making a testimonial about how great my experience was. I was very loopy when I said this, but anyways, I'll include that here so you guys can kind of understand that I was already like, woo, you know, going into it and totally fine by the time I was ready to be put under.
Going through this process, it's something else. I'll see you guys on the post.
Excellent. So now you can relax, you can enjoy the ride, and have a really nice sleep.
I also documented my healing process over the course of the first 2 weeks, so here I am, one day post-surgery. They usually start off very high on your chest. You won't have much cleavage. You'll look very square. Don't panic. They do start to go downwards. I also had some bruising surface. This will really change from person to person. I was told I bled a lot, and that explained the increased bruising, but it had already started to go away a few days later at 1 week post-op. Cleavage lines are starting to come together. Your dominant side, however, could take a little longer to fall, which is totally normal. 1 week after surgery, I went for my first follow-up with Dr. Leblanc, where he took this photo that you're seeing down here at the bottom of me lying down. I just really want to show you guys the extent to which he corrected my lateral displacement. I am so happy, like I could literally cry. And here's what I'm looking like 1 week later. The implants are slowly starting to descend, soften, and round out. My right side is my dominant side and a little tighter there, so it's a little slower on that side, but the cleavage lines are coming together beautifully. I also wanted to show you a side-by-side comparison of me 2 weeks post-op at my first surgery versus this revision. I think these photos really depict perfectly the power of the internal bra and proper implant placement. The size increase that we made at my revision is actually not as significant as you guys might think. What you guys are really seeing is the result of, yes, better implant placement, but also using a firmer as well as higher projecting implant. From the bottom of my heart, I truly had the most amazing experience with Dr. Leblanc's office, from the support that they offered to the results that I dreamt for. I truly hope this video was helpful for so many of you girls who might be considering this procedure.